Hello, my name is Marcella. I'm a Nightingale nursing student. I'm also an LVN. I don't have a Nightingale name tag, so I'm using this one here. I am submitting my skills video. It's the third video that I've done. Apparently, the last one didn't catch the volume on it for some reason. So anyhow, here I am again. Hopefully I have enough supplies to keep going through this. But anyhow, I'm here today for my skills IV insertion. I'm also full body certified, so I am skilled in drawing blood. I'm just not IV certified. So first thing I'm going to do is when I get at the hospital, I'm going to get a report from my team and my orders and my patients for care. So it looks like I have patient Mrs. Smith. She's here for operative procedure. She needs an IV line placed to be able to receive IV hydration fluids and also receive antibiotics and any kind of blood draws that she'll need while she's here. So the first thing I'm going to do is I'm going to go make sure I have all my supplies, which I do. I've got my IV catheter, Tegaderm, normal saline, sanitizer, my gloves and my kit, my IV tubing here, and my tourniquet with some tape. Okay, all right. So first thing I'm gonna do is I'm gonna knock on the door, introduce myself, and ask questions of the patient, verify the patient. Knock, knock, knock. Hi, hello, good morning. My name is Marcella. I'm gonna be a nurse today. Looks like you're here for a procedure today. Yeah, great. I hope everything goes well for you. So I'm here today because it looks like you're gonna have an IV placed in your arm for some orders the doctor has to be placed in your IV site. Can you please verify your name and date of birth? All right, Mrs. Smith, your birthday is 9/4/97. Great. All right, sounds good. Any allergies and medications, Miss Smith? No? Good. Okay. And have you ever had an IV placed? Are you familiar with the procedure? No? Okay. So let me explain. We're just going to go ahead and take a look at your forearm. Look for the best place fit for, the best IV site that you may have. And determine from there where the proper placement will be to be able to put an IV in your sites and to make sure that there is a accurate infiltration flow with no issues or no blockage. And it shouldn't be painful. It'll be about 5 to 10 minutes. Are you okay with that? Great. Any allergies to any medication before we get started? No? Great. Okay. Sounds good. All right. So I'm going to get started with you here, okay? I'm going to get here and wash my hands. Soap, water, sanitize. Okay, put my gloves on. Okay, and then I'm going to place a tourniquet on your arm here. Okay, we're going to go ahead and put the tourniquet right over here. I'm going to go ahead and just tie it a little bit snug tight to make sure we get enough pressure to get the blood flow going in the vein and be able to insert this IV insertion properly. Okay. Alrighty. It's got to be about 4 to 6 inches above the inserted site. Don't apply tourniquet too tight. Check for presence of distal pulse. Okay. All right, next thing I'm going to do is I'm going to grab an alcohol swab from my knee kit here. I'm going to clean this site, and I'm going to clean in a circular motion. Okay, get rid of this here. All right, and then I'm going to get the vein, anticipate insertion by placing the thumb over vein 1 to 2 inches the distal site. Gently stretching against the skin. All right. Okay. And I'm going to have my catheter ready here. And so I'm going to 18 gauge, the lowest, the smallest gauge. Birth catheter that will accommodate the therapy for the patient needed. Okay. So the site is cleaned. I'm going to let it dry for a little bit. I'm also going to get the rest of my supplies here. I have my IV tubing, and I'm going to connect the normal saline and make sure that there is no clamps in the tubing here. I can prime it. You see there's like drips here. I don't know if you can see in the video. There we go. Okay. So everything goes through thoroughly there. Okay. And then I'm going to get that set down to the side there, knowing that's ready to go. Then I'm going to get the needle here. Should be a bigger needle, but I don't know. I think this is ran out of supplies. But anyhow, we're going to make sure that the bevel's up. Okay. Bevel is up there. Okay, we're going to pull down. I'm going to stabilize the area here. And we're going to use the thumb finger, index finger to hold down here. We're going to go about 30 to 40 degree angle. We're going to go in about 1/4 of an inch once we push the catheter in to make sure it's nice and secure in place. Okay. And then we're going to push, release, and the catheter's in place. Okay. All right. Dispose of this here. Then I'm going to grab the IV tubing that kind of just twist onto the little cap thing here that's attached to the IV. And I'm also going to hold my IV, make sure it's secure in place, not let it go anywhere because we don't want it to pull out and have to roll it again. Okay. All right. The next thing I'm going to do is I'm going to go ahead and check for a flash of blood come back. Make sure that their infiltration is flowing properly. So I'm going to pull back. Looks like it's blowing some blood out. I'm going to push that back in to secure it without no bubbles. Okay. Once that's secure in place, we can go ahead and disconnect without letting go of the IV site, of course, because you don't want it to pull out. I'm going to go ahead and do that. And then I'm going to grab my Tegaderm. And I'm going to just secure the site here. So I'm going to open the Tegaderm here. And place it. You see the little tip at the bottom will kind of go over the tip of the, don't cover the whole port, but just the insertion site. The best you can. These things are kind of hard to be so perfect with, especially they're so sticky. And then you remove the dressing film from the top to make sure it stays on securely. Okay, how's that, Miss Smith? You doing okay so far? Yeah, good. All right. So it's in place. I mean, catheter's in place. It's snug fit, nice and good place there. Okay. All right, Mrs. Smith, I'm going to just take this IV here to the side with some tape for now until we have access to it, okay? There's also a little clamp that'll kind of hold on to it, keep it together so nothing flows out. Make sure this is clamped. Okay, all right. Goodness, see the way that it works, huh? All right. So we're just gonna say that we taped it there a little bit to hold down, you know, not much tape. Okay, so then when I'm done here, I'll remove my gloves. Wash my hands, document, step out the room, document everything that I performed. Also make sure that I labeled IV before I left the room. Name, patient, date of birth, the time it was placed, the IV. So we'll go right on the IV tubing there. And I'll walk out and then spend some time has passed by. Now it's time for the patient to have the IV removed. Procedure went well. Everything went well. So I will gather my information, my discharge orders, make sure I have all my supplies to remove the IV, which will just be an alcohol swab with some gloves and some tape to tape down the area. Okay. All right. I'll come in the room. Knock, knock, Mrs. Smith. Hi, Miss Smith. Good morning. Good morning. My name is Marcella. Do you remember me from the other day when I put the IV in? Yeah. Okay, great. How'd everything go? Good. Good. I'm glad to hear. I'm glad things went well. I'm glad you're able to go home. Good thing is we get to remove your IV. So I'm here today to remove your IV. Is that okay? It won't be painful. It'll be quick and easy. All right, great. Perfect. So we'll go ahead and get started here with removing your IV. So wash my hands. And then just verify your date of birth for me. Your name, date of birth one more time. Mrs. Smith, 9/4/1997. Perfect. All right, so I'm going to get my gloves here situated. It's kind of a hot mess with these gloves, so we're doing this. Let me just get another set. Okay. All right, so that's a tiny snug fit. So another tip when you have gloves, not too snug, not too loose, especially for ripping or not having enough secure, proper protective gear. Okay. All right, Miss Smith, I'm gonna go ahead and remove your IV. First thing I'm gonna do is I'm going to remove the tegaderm off of you here. I'm gonna hold this in place. Okay. I can actually use the gauze to do that, sorry. Hold this down like this. Okay. And then get rid of that tape, it's so sticky. Oh my goodness. Okay, and then put a little Glycor, pull the IV out here. Nice and slow, put some pressure down. Get rid of this, dispose of this. And the sharps, hold on for about 20-30 seconds. Okay, let's see if that's been about 20-30 seconds. We're gonna go ahead and grab some tape here to secure the area down with the gauze. Either around the whole arm or just across the arm, whatever works best. Probably, sometimes I think wrapping around the whole arm works best to make sure that the pressure stays in place. You don't cause any kind of hematoma or something like that after or any type of bruising after the IV insertion is removed. So, Mrs. Smith's IV has been removed. Her bandage secure in place. Mrs. Smith, are you doing okay? Yeah, great. Any questions or concerns for me? No? Good. I'm glad things went well for you. I'm going to go ahead and clean up my area here, communicate with the doctor that your IV is out, get your discharge papers ready to go, and I hope things go well for you. Please don't be afraid or hesitate to ask any questions before you leave. And please continue to keep the bandage on for a little while to prevent any kind of, like I said, hematoma, bruising, any excessive bleeding, and allow for the area to blood clot properly. So I will just check in with the doctor, and I wish you the best of luck. Thank you, Mrs. Smith. Take my gloves off. Wash my hands. Exit the room. Document everything I did, time of removal, how the site looked, patient's response, how patient did, the discontinuing orders, report to the SBAR to the doctor, get everything situated for the patient to be able to go home. And so that's the end of my IV insertion and discontinuation video. Thank you.